Hello, Danny Blyth from CICM looking at spleen syndromes. Remember, this is for acupuncture students only. Please pause and read. There are only two syndromes. Spleen Qi Deficiency is deficient and dampness is a full syndrome. Spleen is most linked to the Qi. We remember the functions of Qi are transforming, transporting, holding, raising, protecting and warming. Protecting and warming are to do with the Wei Qi and not relevant here, but these other four are very relevant. And the functions of the spleen, so govern transformation and transportation. Controlling the blood is holding the blood plus the blood production. Raises the Qi. Also dominates the muscles and the four limbs, so we expect to see symptoms in the muscles and the limbs. Opens into the mouth, so we expect to see things to do with taste, and manifests in the lips. And houses the E, which is thought. So we're expecting to see thought being affected. Our basic spleen qi deficiency. We're going to look at transformation, transportation, muscles and four limbs, and housing the E. We're going to forget about the rest for now. If the gu qi, the food qi, isn't transformed and transported, we're going to get tiredness, key symptom, wanting to lie down, pallor, weak limbs, tongue's going to be pale and quivering. If the food and digestion isn't transformed and transported, we're going to get poor or an abnormal appetite, abdominal distension after eating, loose stools which could have undigested food in, or there could be diarrhea. What do we mean by poor or abnormal appetite? This could be craving carbs and sugar, wanting energy from food without digesting too much, missing meals, small appetite, just not eating much, wanting little and often, or having a small range, so only fancying a few things. In terms of the E, we have lassitude, which is just a posh Latin way of saying tired, but implies tiredness of body and mind, and inappropriate overthinking and worry. To remember that gu qi from the spleen and stomach goes via the heart and lungs to produce blood, hence we get spleen blood deficiency, and it also with air becomes zong qi, zhen qi, and this becomes the wei and yin qi, each of these transformations being activated by the yuan qi, the qi transformations. So you can see how you get spleen and lung qi deficiency as combined syndromes. Yin yang deficiency is a more severe qi deficiency, so we see more severe tiredness, the stools become worse with more undigested food and more prone to diarrhea. We see the body fluids less transformed, so we start to get edema and a tendency to weight gain. And the lassitude becomes spiritual fatigue, a level deeper. We also have a relative excess of yin, which manifests as empty cold. So we get symptoms like feeling cold, cold limbs, wanting to curl up. The pulse goes from being deficient to being deep and weak, and the tongue also becomes wet with body fluids. Qi sinking is essentially the usual spleen qi deficiency, but the raising qi function of the spleen is particularly affected. So we get bearing down sensation in the abdomen, and there can be a prolapse. Prolapse of the uterus and the vagina typically comes as a result of childbirth, but happens gradually as you get older, more prone to it. So there's obviously some kidney deficiency and can give you urgent urination, urinary problems, or constipation and bowel problems. Prolapse of the anus is common in younger children and older patients, and also menorrhagia, heavy periods, or hemorrhoids. So the raising qi function of the spleen becomes depleted. Spleen not controlling the blood, we get the usual spleen qi deficient symptoms, but the spleen's role of controlling the blood is particularly affected. So we get menorrhagia, metrorrhagia. Meno is of the period, metro of the womb, and rhagia is to burst out. So menorrhagia is heavy or prolonged period, and metrorrhagia is frequent or irregular period, bleeding outside of the normal period. Chinese medical terms, this is bung lo, which is flooding and spotting. And we get easily bruising, or blood leaking into the urine or stools. Ptaschii are little spots of bleeding under the skin, and purpura, small patches of bleeding under the skin. If you get purpura plus a fever, then you have to red flag. This could be meningitis. As with all symptoms, and especially red flags, always get them checked out with a doctor as well, for things like blood in the urine or the stools. And the spleen qi is weak, it doesn't control the water, and the result is often damp. You can see a mixed pattern of spleen qi deficiency with damp. So we get some of the usual symptoms of spleen qi deficiency, along with things like abdominal distension after eating. Damp obstructs the qi and gives a stuffy chest and epigastrium and nausea. And damp obstructs the rising of clear yang, we get a muzzy head. And because of the limbs, we get heavy limbs, damp obstructing the muscles. The nature of damp is that it's a yin pathogenic factor. It's slow to come, slow to go. It impairs yang, obstructs the qi. It's heavy and dirty in nature, and sticky and lingering. Damp invading the spleen. This can be an acute invasion or a chronic build-up. We get impaired yang, so we feel cold, have no thirst, or a thirst with no desire to drink. So somebody gets themselves drinks and ends up not drinking them. Feeling cold in the epigastrium, and this is better with warmth. We also get obstructed qi, so the stomach qi rebels because of the blockage in the middle jiao, so we get nausea and vomiting. The qi is obstructed in the upper burner, giving us a stuffy chest. In the middle and lower burners, giving us stuffy epigastrium and abdomen, poor appetite and loose stools. And in the muscles, giving us heavy body and limbs, and sluggishness, which can describe our digestive system or general feeling of sluggishness. The clear yang can't rise up through the damp, so we get heavy head, and we get sweet or reduced taste, and lassitude again. This damp is heavy and dirty, so we get heavy limbs, heavy head, muzzy head, like a wrapped in towel head, and we can have a white vaginal discharge. Pulse is slippery, tongue coat is thick, sticky and white. The damp is hot in nature. First of all, we get damp heat signs, so rather than the signs of impaired yang and cold, we get low-grade fever, low-grade because it's heat with damp, thirst with no desire to drink rather than no thirst, scanty dark urine, skin eruptions, sweating from the heat, but it doesn't relieve the fever because of the damp. We also get dull pains, so the stuffiness in the abdomen can actually become abdominal pain, and the heavy head can actually become a dull headache. The sweet taste becomes a bitter taste. The vaginal discharge becomes yellow, the pulse becomes rapid, and the tongue coat becomes yellow. Damp heat is particularly stubborn because damp obstructs the qi, which tends to cause heat, and heat thickens up the fluids, which tends to create more damp. Etiology of spleen qi deficiency is poor diet, which can happen in a number of different ways. Worry and overthinking, which can be too much studying, worrying, sympathy, putting others' needs before your own. It can be environmental or external damp, living in a damp environment or getting damp, and chronic illness. And additions with spleen qi sinking, standing can be a problem, and also lack of exercise. The lymph not moving can lead to spleen qi deficiency. Damp, it's either an external invasion, a bug, or the living environment. It's internally generated by the diet or by a weak spleen, or with damp heat, contaminated food, so food poisoning. Reminder of those, so we've got basic spleen qi deficiency. This is the main symptoms only, so no or an abnormal appetite, tiredness, weak limbs, loose stools, possibly with undigested food in the stools. With yang deficiency, there's also feeling of cold and cold limbs. With spleen qi sinking, there's also a bearing down sensation. There might be hemorrhoids, varicose veins, flatness, lowness. With spleen not controlling the blood, we get bleeding symptoms, menorrhagia or metrorrhagia, and easily bruising. If there's also damp, we get abdominal distension after eating and heavy limbs. And then the two full conditions, so these are our empty conditions, this is our mixed condition, our two full conditions. Damp cold invading the spleen, we get feeling of heaviness in the head and the body, stuffy chest and epigastrium and abdomen and with damp heat invading the spleen, main signs poor appetite and feeling of heaviness. Principles are very straightforward. To tonify the spleen qi, if the yang is deficient, warm it. If there's qi sinking, resolve it. If there's damp, resolve it. And if there's heat, clear it. Thanks for listening.